Assalamu alaikum. I am Dr. Fatima Quratulain. I am from Punjab Institute of Cardiology. And I will like to thank the organizers for giving me this opportunity. Today my topic of discussion is identifying novel biomarkers for early detection of cardiovascular disease in women. First of all, I will want to discuss that what are actually the biomarkers are. It is objectively measured and evaluated as an indication of normal biological, pathophysiological and pharmacological responses to a therapeutic intervention. To be a good biomarker, it should be accurate, reliable, and should have a therapeutic impact with early intervention. Biomarkers play a critical role in the definition, prognostication, and decision making regarding the management of cardiovascular events. Cardiovascular disease, rheumatic heart disease, and cardiovascular illnesses are the leading causes of global mortality. That's why they are today the important topic for discussion worldwide. And heart disease claims the lives of 17 million individuals every year around the world. By year 2030, it's expected to rise to 23 million individuals will have died from cardiovascular disease, principally from heart disease and stroke. That's why biomarkers are that much important that you should early diagnose the disease or be suspected to use, diagnose, monitor cardiovascular disease to reduce the global mortality rate. So in women, previously it was said that this is disease of mainly males, but now the perspective has been changing rapidly because the cardiovascular disease represents the leading cause of death among women in in study in Europe. It's about 53% of female deaths are due to cardiovascular disease, particularly coronary heart disease and stroke. And women with diabetes are even more liable to die from a cardiovascular disease than men. And the incidence of cardiovascular disease in premenopausal women is less than men because of their hormonal protection, but in postmenopausal period, women are even more susceptible than men to the cardiovascular disease. So there are some gender-based differences in cardiovascular disease in men and women. Some of them are higher prevalence in women over 75 years. The first coronary events mostly occur 10 years later in women than as compared to men. Women have more atypical symptoms for cardiovascular disease, and there is high incidence of non-Q-wave myocardial infarction in women as compared to men. And the prevalence of coronary arteries without angiographic findings is twice as common in women as compared to men. So current studies are focusing on novel biomarkers because traditional cardiovascular biomarkers and their assessment scores underestimate the risk in females. Biomarkers have different types of composition. Basically, in cardiovascular diseases, myocardial infarction, ischemia, arrhythmias, thrombosis, atherosclerosis, they all lead to myocardial damage and necrosis that result in release of biomarkers. Some of them are like protein-based, some of carbohydrate-based, gene-derived biomarkers, nucleic acid-derived biomarkers, and some are lipid-based biomarkers. We are going to discuss some of the important novel biomarkers, and one of them is carbohydrate-based biomarker, that is glycogen phosphorylipase BP isoenzyme. This is a novel biomarker that is being studied recently. It's a cardiobiomarker that might help identify myocardial ischemia early. GPBB is a more sensitive marker for diagnosing ACS within 4 hours after the beginning of chest pain, with a sensitivity of about 81% and specificity of 93%. However, there is an expected increase in plasma GBB concentration during pregnancy, and it also found in the brain normally. That's why there is no absolute specificity for identifying the coronary injury, but it is deployed as a secondary biomarker for detecting acute myocardial infarction. Most of the biomarkers that we use in clinical practice are protein-based. You all know some famous of them are like high sensitivity cardiotroponins, interleukin-6, pentatoxin, AST, LDH, carbonic anhydrase, and many more. They're all protein-based biomarkers. And then some are important lipid-derived biomarkers like triglyceride to high-density lipoprotein cholesterol ratio, low-density lipoprotein cholesterol, and lipoprotein-associated phospholipase A2, and oxylipin. We will discuss them later on. Classification of, and there is another important classification of biomarkers that are based on inflammatory markers, markers of hemostasis. Inflammatory biomarkers that routinely used in a clinical practice are high sensitivity CRP protein, fibrinogen, interleukin-6, MMP9, and E-selectin. We will discuss few of them. High sensitivity cardiotroponins have recently we have found some of them that even more sensitive than the previously used cardiac troponins. Their sensitivity increased the accuracy of acute MI diagnosis at the time of presentation. A recent study showed that there is a strong correlation between the baseline concentration of circulating high sensitive cardiac troponins and the risk of all-cause mortality, death, heart failure in patients with both type 2 diabetes and stable coronary artery disease. The emergence of these high sensitivity cardiac troponins has changed the role of cardiac troponin from a marker that was initially just used to diagnose the acute MI, but now they're also being used as a marker to assess ongoing myocardial injury in stable patients and even seemingly healthy populations. There are some important differences from the previously used cardiac troponin, that there is detection of high sensitive cardiac troponin in a substantial number of healthy persons as well, and there's a more precise definition of normal level with 99 percentile with a more precise assay. Another important biomarker is high sensitivity CRP, that is an immune response protein and is a non-specific inflammatory marker. Its high sensitivity assays are useful for predicting cardiovascular risk. CRP levels in women are more important than men, especially during puberty years in detecting the coronary artery disease. And the greater number of cardiovascular risk factors that apply to a woman, the higher the CRP levels would be. That's why the European Society is giving a class 2B recommendation that high CRP may be measured as a part of defined risk assessment in patients with unusual or moderate cardiovascular risk profiles. Fibrinogen is another important cardiovascular biomarker that because the higher level of fibrinogen are associated with an increased risk of cardiovascular disease in both men and women. Fibrinogen levels increase with menopause and also with the use of oral contraceptives and pregnancy. That's why in the post-menopausal women who are on hormone replacement therapy, they will have low levels of fibrinogen. And that's why European guidelines also giving it a class 2B recommendation for the risk assessment in patients with unusual or moderate cardiovascular disease risk profile. Interleukin 6 also stimulates the release of CRP and fibrinogen, both acute phase reactants that's involved in the process of atherosclerosis and atherothrombosis. But there is contradictory data regarding interleukin 6 itself in the development of coronary heart disease in women. Cardiovascular disease was not assessed only by the interleukin 6 plasma levels, but it can be determined by assessing other associated cardiovascular risk profile. Some important hemostatic markers are like plasminogen activated inhibitor 1, lipoprotein A, lipoprotein associated phospholipase A2, and homocysteine levels. Plasminogen activator inhibitor 1 is like one novel biomarker that has been recently being studied because it identified lower PI1 levels in premenopausal women than postmenopausal, and the concentration of PI1 was lower in women taking hormone replacement therapy compared with non-users. There is also some gene specification related to this biomarkers that showed that 4G, 5G mutation was found more frequently among postmenopausal women with coronary heart disease than in premenopausal women. Lipoprotein A is another important novel biomarker because it's increased risk of ischemic heart disease in both genders. In emerging cardiovascular risk profile, both pre and postmenopausal women, it contributes to the formation of atherosclerosis, especially when it is combined with elevation of other cardio biomarkers like high CRP and increased LDL levels. New research on women offers strong evidence that heart attack is increased as lipoprotein A levels rise. Lipoprotein-associated phospholipase A2 is involved in the development of atherosclerosis as it modifies the affinity of LDL particles for extracellular matrix proteins. LPPLA2 may be identified as an independent risk factor for the rupture of atherosclerotic plaque and thromboembolic events. That's why European guidelines are giving LPA2 class 2B recommendations for risk assessment in patients with high recurrent acute thromboembolic events. Another important hemostatic biomarker is homocysteine. In women, evaluation in homocysteine levels occurs during the menopausal years, and a number of studies suggested that the relationship between serum homocysteine levels and presence of coronary artery disease is women, and that is not present in men. So that this is an important biomarker that should be studied more in women, and that's why European guidelines also giving class 2B recommendation for risk assessment in this population. Some other important biomarkers that have been studied recently are natriuretic peptides, growth differentiation factor 15, and ST2. Natriuretic peptides, we all know that they are associated with the continued release from the ventricles, especially as a result of myocardial stretching. BNP and pro-terminal BNP are high individuals with heart failure, making them valuable diagnostic indicator for the disease. And there's a strong correlation between gender, age, and plasma levels of natriuretic peptides. A BNP levels more than 500 picogram per ml represents a strong predictor of death in women than in men with heart failure. And there's a central role in the maintenance of cardiovascular homeostasis in response to volume and pressure overloads. That's why its interest in its study has been increasing for the predictive capacity for identifying cardiovascular risk. One other important biomarker that has been studied recently is the growth differentiation factor 15, because it's a novel biomarker in investigation associated with cellular oxidative stress, ischemia, and strain. GD15 levels are also linked with the promotion of protective mechanisms for inhibiting apoptosis, hypertrophy, and adverse remodeling in patients with chronic heart failures. And there is a certain threshold that have been proven to indicate high-risk individuals with cardiovascular disease. One of the most recently studied biomarkers is suppression of tumorigenicity 2 factor. It's a protein produced by the cardiac myocytes, and its levels rise in response to mechanical stress on the heart. Its special role has been discussed in heart failure patients because it has been shown to be an independent predictor of mortality or need for transplantation in patients with chronic heart failure. And it also provides prognostic information for patients with acute heart failure when combined with natriuretic peptides. So thank you so much. These were some novel biomarkers discussed recently.